Good morning, everyone. This is Sai Krishna, second year postgraduate, Department of General Medicine. My topic is effect of soleus exercise on pannal blood sugars in dysglycemic individuals, done under the guidance of Dr. Arunis. Coming to introduction, diabetes is a leading metabolic disorder causing severe organal damage through micro and macrovascular complications. So there is emphasizing the need of strict glycemic control. Soleus muscle being predominantly composed of slow-twitch oxidative fibers with high levels of GLUT4 and hexokinase levels, continuously utilizes blood glucose for energy. Also, it is a fatigue resistant and active even during low intensity movements. So its target activation through simple exercise can serve as a easily adaptable lifestyle modification for better glycemic regulation. So coming to my objective was to estimate the prandial glycemic change with soleus exercise in dysglycemic individuals. Also to compare the variation to prandial glycemic in dysglycemic individuals with and without exercise, and to compare this effect of glycemic change with regards to three parameters: BMI, duration of diabetes, and current glycemic control. So materials was it's an observation analytical study which was done after IEC approval. Outpatients and attendants were explained about the procedure and informed concerns were taken. So day 1 soleus exercise protocol, participant consumed 25 grams of roasted groundnuts and then performed supervised soleus push-up contractions for 1 hour while seated with no more than 5 minutes of break or no less than 10 minutes of continuous exercise. Exercise condition participant fasted for at least 2 hours before the test and were allowed water during the exercise, and their blood glucose were measured before the glucose load and 1 hour after it. Day 2, same patient was called again and consumed again 25 grams of roasted groundnuts and remained sedentary for 1 hour, and again blood glucose were measured before and after it. So the arrived blood glucose were being compared and analyzed using IBS statistics. So a total of 38 samples were taken. The distribution among the samples were majority of the samples were in the normal BMI range of with mean BMI of 23.0, and majority of the samples were having poorly controlled HbA1c with more than 8 HbA1c with mean HbA1c of 8.5, and majority of the samples were having duration of diabetes less than 5 years. So mean of duration of diabetes was 6.3. Results of my study: first objective was to estimate the prandial glycemic change with exercise group. As you can see here, in exercise group, pre-GRBS mean of all samples was 225 and post was 174. Same without exercise, pre was 205 and post was 277. Coming to my second objective was to compare it with both with and without exercise, for which delta GRBS was being derived, which was post minus pre-GRBS. In exercise group it was minus 16.2 and without it was 71. So both of which was underwent paired t-test, which was significant. So this glycemic change was further compared with three parameters. First is being with BMI. In BMI, with normal BMI, there was significant difference noted in delta GRBS as compared with and without exercise group. Coming to in overweight individuals, there is no significant delta GRBS noted in exercise group. Even though there is no much difference as compared with without exercise group, the difference in delta GRBS was much less in with exercise group. Coming to correlation of glycemic change with duration of diabetes, across all the groups of duration of diabetes, there was significant delta GRBS noted, but samples with duration of diabetes less than 5 years showed more significant difference than longer duration of diabetes. Coming to correlation of glycemic change with glycemic control, for which HbA1c was being taken, majority of sample across all the HbA1c sample range, there is significant difference in delta GRBS noted, but poorly controlled HbA1c of more than 8 showed more significant reduction of prandial blood sugars. So for which further poorly controlled samples were again crossed across duration of diabetes. So total of 22 samples of HbA1c more than 8, out of which duration of diabetes were having total 13 samples were having less than 5 years duration of diabetes. So coming to summary, there is a statistically significant difference in change in pre and minus post prandial blood sugars in exercise group as compared to other, out of which normal BMI were associated with greater response, shorter duration of diabetes were associated with greater response. Despite poorly controlled diabetes with HbA1c of more than 8 showed better response, but these findings were limited only to shorter duration of diabetes. So incorporating soleus exercise in daily routine can aid an easy and non-strenuous strategy to improve glucose metabolism, reducing the diabetes progression.
What is special about soleus muscle?
Sorry, sir.
What is special about soleus muscle that quadriceps doesn't
So
have?
first thing is it has high levels of GLUT4 receptors and hexokinase, and also it's a fatigue resistant because of low levels of glucose pyrophosphorase. So because of which less amount of lactate is being produced, and continuous blood glucose is being utilized because of. So that's.
So when this gets translated to a clinical thing, do you think that after all 3 meals patient should be doing it?
Sorry.
No, because this particular meal related change in glucose that you have shown.
Yes, sir.
So do you think that as a clinical application of this method, should people be doing it after every meal? Second is, will the constitution of the meal, that the groundnuts that you gave, will the response of glucose response be similar across different patterns of meal, like high protein meal pattern or low carb, high carb meal pattern? Will it be same, or what do you think?
Yes, sir. So first question, doesn't it reduces completely the levels of glucose. It just aids in disease progression. And coming to second, so it depends on each variability of each consumption of each diet. So I have taken with high protein diet, which unlikely for blood sugars to be raised. And if the same person consumes with high carb diet, even the blood glucose can vary much level, and the drop can be not more significant.
What are the current evidences with the soleus exercise in the literature?
So current evidence was done with more duration of exercise duration, with pandal time being more than around 3 to 4 hours, which showed significant difference in drop of GRBs. But I have taken with pandal time which is less than 1 hour due to the availability of sample duration.
What will be your recommendation if you want to implement it in clinical practice? What will be your recommendation to the patient?
Yes.
How long they should exercise, and what are the benefits based on the literature and your?
So recommendation being immediately post pandal, during any office hours, even long time who are having this, they can aid in their routine lifestyle, and would not completely cure it, but just helps in the disease progression or duration of diabetes. Yeah, but those conditions we were excluded actually, I didn't mention. Yes, sir. But all those neuropathy and all we have excluded now. So that was a limitation. And also we have included only, most of them were diabetic, pre-diabetic also we have not considered.